We are at Rush University Medical Center, and this morning we have John Danks in our operating room. John has a problem with his left shoulder. The injury that he had hasn't gotten any better despite all the treatments that we know are effective, and so our surgery is now scheduled for John. I think that your problem is a bit of a complex one, as it oftentimes is in overhead throwers, but fortunately we have a lot of experience with that.
Thought I'd be a wreck, but actually doing all right now, so it's good to get it fixed, get it taken care of, and get back on the field as soon as possible. I feel very comfortable with these doctors. These are guys that I've been around a lot and trust, so all will go well. I'm pretty confident in it.
Can you dim the lights? Are you sleepy?
Yeah.
Okay, all right.
I was sleepy.
So turn your head. That's all you have to do. Don't move your head. You have the local? When I do this, your biceps might twitch a little bit, okay? You're fine, everything is good. You just have to keep your face down. You're doing great. Tiny little stick, and no, that's all you're going to feel.
We know that John hurt his shoulder about 4 months ago, and when he did that, we saw from the examination and his MRI that he had torn the inferior part of the capsule of his shoulder joint, and in addition he had an injury to the back part of his shoulder as well as to the area that's known as the rotator cuff tendon. These are not that uncommon in baseball pitchers, the rotator cuff and the labrum, but this part in the front, which is the anterior capsule, that's unusual. This surgery, as it is with most Major League Baseball pitchers, is done in an arthroscopic manner, which is basically we have a small tube that has a light and a camera so that we can look inside the shoulder and essentially verify what we're aware of from MRI. And once we see it, we can then develop a strategy on how to fix those things. So at the time of surgery, when we went in, the first thing we did is look from behind towards the front. And sure enough, we saw that this front part of his capsule had been torn. And so the very first part of the surgery was preparing that area, and then arthroscopically, again through little tubes, we passed the sutures through and we tied that capsule back down and repaired the injury that was definitely from his recent problem that he had in May. So that part was completely repaired, very solid, back to its normal anatomic position. The second thing we did is we looked at the back rim of his shoulder. There had been some bruising or irritation back in there, and that was all cleaned up so it was nice and smooth. The third thing is we looked up at his rotator cuff, and he did in fact have a partial thickness tear. Again, not uncommon in baseball pitchers, especially when they've been throwing for a number of years. And so the treatment for that, as long as it doesn't go all the way to the outside, is we debride or clean up that area and smooth off all the edges. We also took some of his blood and spun that down and took the growth factors that are in there and injected at the site to try to help that to heal up too. One of the amazing things about the arthroscopic procedure is that we actually, with the light and the camera, we are magnifying the area by 15 times what we would be able to see if we had made an incision and opened up his shoulder. In addition, all of the normal structures are left almost unharmed. The only injury is almost like a bruise where we just poke through the muscles so we get in and do all of our work. Immediately, he's actually going to be a little bit uncomfortable for the first couple of days, but by 4 or 5 days after surgery, his pain will go away very quickly. He might still have some discomfort at night, and it'll just be a matter of trying to keep him patient as he goes through the recovery phase.
1, 2, 3.
The road to recovery is not a fast thing, no matter how hard we try to accelerate the process.
Hey John, everything's done. Everything went great.
Everybody has a certain way of healing and a certain way of recovering, and we'll have to be in tune with John's body and his shoulder and how he recovers so that we can get him back, just like we did with Jake, and make sure that he stays back and stays healthy and can continue on.